Hello, welcome to United Way of Southeast Louisiana's Public Policy Educational Session 1. This session will focus on the state budget priorities, high quality care in education, paid family leave, health and maternal health outcomes, and community strengthening. We will start shortly. Good afternoon. My name is Todd Batiste, and I serve as the Senior Vice President for Education and Youth Initiatives. I will be your host for today's program, and as we get started, I'd like to clarify a few housekeeping rules. This session will be recorded and shared with the registrants. There will be time for questions and discussion at the end of the program. I'm asking you to please share your questions using the chat function. I'll now hand the program over to Ron McLean. Ron is the Executive Director of the Institute for Mental Hygiene of the City of New Orleans. He has more than 30 years of experience in social service administration and university teaching in the field. Ron currently serves as United Way of Southeast Louisiana's Public Policy Committee Chairman. Please join me in welcoming my friend, Ron McLean.
Thank you so much, Todd. I'm really, and also I want to thank everybody who's here today, all the participants. I'm pleased to serve as a member of the United Way of Southeast Louisiana's Board of Trustees and as chair of the Public Policy Committee. Some people may ask, why are we hosting these sessions? Well, every year, United Way of Southeast Louisiana creates an agenda outlining our priority public policy issues in health, education, financial stability, and community strengthening in preparation for the start of each state legislative session. United Way's legislative agenda advances our fight to eradicate poverty in Southeast Louisiana through the Blueprint for Prosperity by supporting ALICE households. ALICE households are asset-limited, income-constrained, and employed individuals. We focus strongly on public policy because it's one of the most effective ways to drive the systems-level change our community so desperately needs. These educational sessions allow our Public Policy Committee to gain insight from experts on key public policy issues and develop a comprehensive legislative agenda. We also collected information on the legislative priorities of United Way's community impact partners, who provide critical on-the-ground services to vulnerable populations across Southeast Louisiana. It is now my great honor to welcome today's esteemed panelists, my good friend, Jan Moller, with the Louisiana Budget Project, and of course, my colleague, Dr. Libbie Sonnier with the Louisiana Policy Institute for Children, Stacey Roussel with the Louisiana Budget Project, Frankie Robertson with the Amandla Group, and Morgan Shannon with the Power Coalition for Equity and Justice. Great group of panelists, and we're really excited to hear from you. At this point, it is my pleasure to introduce to you Michael Williamson, President and CEO of the United Way of Southeast Louisiana. Michael will frame today's presentations by providing you an overview of the ALICE households in Southeast Louisiana. Please join me in welcoming Michael Williamson.
Well, thanks, Ron, and thanks everybody for joining us today. Let me start out maybe introducing you or reintroducing you to ALICE. As Ron said before, ALICE is an acronym. It stands for Asset Limited, Income Constrained, Employed. And ALICE may be a friend of yours or a relative. In some cases, folks on this call may be ALICE themselves. ALICE is often a cashier, a waiter, a child care provider, and other members of our essential workforce we so desperately needed during COVID. And ALICE earns the federal poverty level, but less than what it costs to make ends meet. Let's dive a little bit deeper into who Alice is. These are struggling households that are forced to make impossible choices each day. And while such hardship is pervasive, households of color are disproportionately Alice. Alice also represents the data reshaping the dialogue around financial hardship and a grassroots movement that is picking up steam across 30 U.S. states and counting. Now let's talk about Alice in Louisiana. Over time, we're seeing a few trends. One, we've seen cost of living increase more for Alice households than overall inflation as measured by the Bureau of Labor Statistics and the Consumer Price Index. We saw worker vulnerability increase with growth in low-wage jobs and more fluctuations in hours, schedules, benefits, while their wages remained stagnant. And the number of Alice households increased, and while the percentage of households in poverty in Alice remained flat in 2021, due largely to the pandemic aid that is yet to expire, new data shows that the total number of households living under the Alice threshold is set to increase. So we anticipate the number of Alice households will increase in our next report, which will include data from 2023 as the pandemic aid expires and as expired and inflation continues to grip our nation. Louisiana also had the second highest Alice rate in the nation, with 51% of households living below the Alice threshold, only behind Mississippi. Now we'll dive a little bit deeper into Alice in Southeast Louisiana. In 2021, 49% of Southeast Louisiana households had income below the Alice threshold, meaning they were unable to afford even the most basic of budgets. Pandemic supports moved Alice families from the threshold, but expiring aid once again will leave thousands of families in a financial crisis moving forward. Now I want to pivot to equity for Alice and tell you what that means. Creating equity for Alice means illustrating how barriers by race, ethnicity, age, sex, gender identity, sexual orientation, zip code, health, ability, veteran status, and/or immigration status limit life outcomes, and working to remove those barriers. So we're working to remove all those barriers so that people can fully participate in all aspects of the social and economic systems that we have available to us. Now, through this educational series, we strive to recognize and document the role that structural inequities in the lives of Alice families, the structural inequities, the Alice families face by doing a few things. By using the best possible data to show where opportunity is and is not available, where it is easiest to fall into hardship, and what structural changes are needed to make Alice individuals, houses, and communities safer and more secure. By holding ourselves accountable and taking a more equity-centered approach in our work, and calling attention to any actions that run counter to those efforts, and being intentionally inclusive and widening the diversity of the network of collaborators in our communities without overburdening any one individual or group. And finally, by advocating for Alice by providing research and data to inform strategies and solutions to assist those who are struggling financially and make ends meet, by shining a light on racist and discriminatory practices and policies in order to affect real change. And we do all this with the ultimate goal of making Alice households have everything they need to live and thrive in this new and modern economy. So with that, I'll turn it back to UWS Southeast Louisiana's board member, Public Policy Committee Chair, Mr. Ron McLean.
Thank you so much, Michael, and thanks for sharing such helpful and sobering in some ways information about the challenges faced by our Alice families. Recognizing some 51% of households in Louisiana live below the Alice thresholds, which means a lot of challenges for a lot of people. But Michael, also thanks for sharing information about how we might effectively respond to the challenges experienced by our Alice families. And we'll hear more about that from the panelists today. It is now my pleasure to present to you our first panelist for today's program, Mr. Jan Moller. Jan is Executive Director of the Louisiana Budget Project, which monitors and reports on state government spending and how it affects Louisiana's low to moderate income families. Please join me in welcoming Jan.
Well, thank you everybody for attending, and thank you especially to the United Way of Southeast Louisiana. We have been partners with the United Way for just about the entire time I've been doing this work. We couldn't do this work without any of the partners that are on this call, wonderful friends and colleagues, but especially the United Way, which not only provides direct, meaningful assistance to people and communities in Southeast Louisiana, but then they back that work up by going to the Capitol and advocating for population-level policies that can lift up families and communities. So we're just so indebted to the work that they do. So our name is the Louisiana Budget Project, and this is not a well-kept secret, but we are about to change our name as an organization, and starting in the next couple of weeks, we are going to become Invest in Louisiana is going to be our new name. And we've gone through a year of work with our partners to arrive at this. And why the new name? It's a name that really reflects why we focus on budget and tax policy. Budget and tax policy are the tools, really, that state government has to ensure that we are really investing public resources in the things that we know will grow our economy, and most importantly, give every citizen, including Alice families especially, the chance to reach their full potential in life. What do we mean by that? Well, the state can invest in education, at all levels. We're going to hear about early childhood education, but when we talk about education, we mean from birth through PhD, making sure that it's affordable and high quality. That means paying teachers adequately so that the profession continues to attract and keep the best people in there. It means making sure people have health care that's affordable and accessible, no matter what their income is. We've come a long way in that regard in the last 8 years, thanks to Medicaid expansion, but there are some real threats to that moving forward. But we also, at the Budget Project, recognize that all of these things, these investments that we advocate for, you have to have the money to pay for these. And so that's where the tax structure comes in. And at Invest in Louisiana, we advocate and support a tax structure that is fair and equitable and equal to the task of investing in Louisiana's people at all areas. And by that, we mean that the people and corporations who can most afford to pay should bear a bigger burden than those at the very bottom who are struggling to get by week to week, month to month. In Louisiana right now, we don't, unfortunately, have a tax code that's equal to the task ahead. And we have one that's upside down. People in the lowest 20% of income earners pay about 13% of their overall income in state and local taxes, mostly through sales taxes that are the highest in the country. Folks in the top 1% pay taxes at half that rate. 6.5% of their income goes to state and local taxes. So we have an upside down tax system that doesn't raise enough revenue. And of course, in Louisiana, as in every state, the budget has to be balanced every single year. That is very different than the debate you hear in Washington, D.C., where a deal means both sides get a little of this, one side gets increased spending, the other side gets tax cuts, you put it on the tab. You can't do that in Baton Rouge. So there are trade-offs in state government that simply don't exist at the federal level. And next year, a week ago today, we got to see the new governor's budget recommendations for the first time. And here's what we know at the start of the budget debate. We know that next year, state revenues are expected to be essentially flat. State government is going to take in next year about what it's taking in this year. And so when you have to balance a budget, that means the new governor had to make some choices in what to fund and, most importantly, what not to fund. And so a week ago, we got our first glance at the priorities of this administration. And what we saw wasn't fantastic. There were some good things in there, obviously, some things we were glad to see funded. But we saw, for example, that the governor elected not to take advantage of an opportunity to increase funding for hungry kids in the summer EBT program that would have cost the state about $3 million. That's about the same amount of money that we're going to be spending to send our National Guard troops to the Texas-Mexico border. So there's a trade-off in there. The governor said no to a permanent teacher pay raise. Instead, he's going to renew the stipend that was included in this year's budget. So teachers are going to continue to be paid well below the Southern and national averages. But there's more money in the budget for state police, for the Department of Corrections, while there's less money going to higher education. So we got some glimpses of the priorities of this new administration. And again, it's tilted more towards law enforcement and less towards education and safety net policies than we've seen during the past 8 years. If you've been following state government, you know that this is probably the easiest budget that this administration will have to balance over the next few years. Next year, things are going to get a lot worse. That is when we have a bunch of automatic tax cuts and tax shifts taking effect in the state government. The biggest of those is a quote-unquote temporary half penny of sales tax, actually 0.45 of sales tax that's dropping off the books. There's also vehicle sales taxes that are going to be shifted out of the state general fund. But the net result is that next year there's going to be a $558 million budget shortfall. The thing that's important to remember about this is it's not a problem the legislature can solve this year because they're not allowed to raise revenue in a regular session. But this is an absolutely self-created problem, and it's not inevitable. It is something that the legislature has the power to solve. And our concern at the Budget Project, and one of the main things we're going to be trying to educate legislators about is the choices that they face next year when they come in during a fiscal session to address this problem. As many of you probably know, almost 3/4, the budget itself is close to $50 billion, but when you take away the federal funding, the self-generated funding, college tuition and all that, you get to the state general fund of about $12 billion. Only about less than about $4 billion of that, a little less than $4 billion of that is considered discretionary general fund. That's the money that the legislature actually controls. And almost 3/4 of that goes to healthcare, human resources, and education. So these are the programs that support Alice families are the ones that are ultimately on the chopping block when the state faces a budget shortfall. So our main objective at the Budget Project, Invest Louisiana, is to make sure that these programs can still be funded and that the tax structure rises to the challenge that presents. But meanwhile, there are a lot of pressures on this governor, this new administration in Baton Rouge, to make this problem even worse. And again, we don't know exactly where the governor is coming down on this, but we know that there are a lot of pressures to cut taxes. There have been recommendations from his advisory panels to eliminate the state income tax for individuals and corporations. That's about $5.5 billion a year that would go out of the state general fund. If we do that, there are going to be other taxes that get raised, and that raises the question of, who's going to pay more, who's going to pay less. Yeah. There are smaller tax cut plans on the table for severance tax, eliminating the severance tax, eliminating the state corporate franchise tax. All of these tax cuts, if implemented, is going to make it even harder to balance the budget in future years. And then there are areas where I think a lot of legislators want to spend more money. One of the things we're going to be watching very closely has to do with education savings accounts. There's a lot of different plans. You probably heard about these, but essentially it's using public school dollars, giving that to parents and letting them spend that on private schools or possibly homeschooling. And our concern is less about choices for parents of children who are already in public schools, but that this could be an added cost to the state if we start subsidizing private school tuition for people who are already choosing not to put their children in public schools. In Arizona, there was an education savings account plan that is now costing them up to $800 million a year in additional funding that they weren't spending before. again, that is going to make it harder to just fund the basic priorities that we have. So I want to be conscious of time, but I want to say, to kind of talk about, and a lot of our priorities, other panelists are going to talk about more in depth, but we are really this year about educating the new generation of legislators about how you create a strong and adequate tax structure to support the needs of the state. And that means either replacing or renewing the revenues that expire next year to kind of fix this fiscal cliff that the legislature created. If we don't do those things, we're going to be looking at damaging budget cuts just a year from now. Another top priority for us is protecting Medicaid program and the state safety net. There have been some proposals that we expect to see debated during the regular session to impose work reporting requirements on people who get public benefits. We've seen the effects of these kinds of policies in other states. We know that they don't work except to get people kicked out of the Medicaid program. They don't actually incentivize work. They do create a lot of paperwork and uncertainty, not just for patients, but for doctors and hospitals. And again, they do not achieve the purpose that they're there for. We're going to be back again to talk about a state minimum wage. That is something that we've been trying for more than a decade unsuccessfully, but it's a debate that shouldn't go away because, again, most people and most Alice households by definition are working, but far too many people in Louisiana who work 1, 2, maybe 3 jobs just don't make enough money, and we can help resolve that through policies. We're going to be talking about tax credits for working families. That's not really a 2024 priority because of the structure of the sessions, but earned income tax credit, creating a child tax credit. We're going to be working with our partners in early childhood to maintain and expand funding for that. We're going to be working on paid family and medical leave. But I think more than anything, we are going to be talking about this fiscal cliff coming up. If you've been around a little while, you remember the budget cut years under the governor before the last governor. Well, there's only a small handful of state legislators who really remember and were there for those times. If you are in your 3rd term right now, and there's a 3-term limit in the legislature, it means you came in when John Bell Edwards first got elected, and you don't really have much memory of what it was like to come in every year and make mid-year budget cuts and make deep cuts to healthcare and higher education. There are a few people who switched chambers. I mean, Francis Thompson is still around. He's been there since the dawn of time, but there's just a small handful of legislators who have that memory. And so I think it is up to us and hopefully many of the partners on this call to really educate policymakers about the choices involved in creating a balanced budget that really makes the critical investments that we need for children, for families, so that everybody has the ability to live safe, secure lives, access the services that they need when they need it. So with that, I want to, again, just thank everybody at the United Way. And it's great to see so many partners and friends on this call, and I want to turn it over to them. I can't wait to hear their expertise.
Jan, thanks so much. As usual, you are right on point as it relates to kind of, understanding the impacts of budget and tax policy. As you shared with us, this is really critical, particularly as we look at an upcoming fiscal cliff that has all sorts of implications for creating barriers and really reducing opportunities for Alice families. So we have to pay attention to those things. Jan talked about how important it is to kind of, continue to invest in children and families. He's also talked about a change in the name of the budget project. So we'll moving forward, we'll be looking at Jan as the executive director of the Invest in Louisiana. Let me get it right. Invest in Louisiana, and it's really talks about the implications for budget and tax policy as it relates to investing in some of our, important families, those who unfortunately are challenged with low and moderate income, and have had some opportunities. But as we look at a new administration, new legislators who are policymakers, it seems like there are many more concerns for our Alice families that calls upon us to advocate, and to pay attention to the data. And thanks again, Jan, for sharing important information about tax and budget policies. It's now my pleasure to introduce my longtime friend, Dr. Libbie Sonnier. Dr. Sonnier has served as the Executive Director of the Louisiana Policy Institute for Children since 2019. Recognized for her tenacity and deep commitment to children, Dr. Sonnier has led teams and system-wide initiatives for the betterment of children, families, caregivers, and practitioners for more than 2 decades. During her time with the Louisiana Policy Institute, she has helped secure and direct more than $1 billion in funding for early care and education in Louisiana, including $84 million in new state funding for early childhood in 2022 and $52 million in new state funding for child care assistance programs in 2023. Louisiana's largest new early learning investments in over a decade. These are the things that Dr. Sonnier has worked really hard to put in place, and she continues to be a leader in early care and education. Please join me in welcoming Libbie to today's program.
Thanks so much, Ron, and thanks so much to the whole United Way team, as well as our partners that are on the call with us today. I'd also like to say that that $52 million and that $84 million is because of many of you that are on the webinar today with us. We don't do this work alone. I say often that the Louisiana Policy Institute for Children, just because we put out some research and data doesn't mean that that moves the needle. It's people like many of us on this call today that we're the ones helping to move the needle. So thank you. And we'll go to my slide next. And so at the Louisiana Policy Institute for Children, our mission really is about advancing policies to ensure that Louisiana's young children are not only ready for success in school, but fundamentally success in life. And we really envision a Louisiana in which all young children birth through age 4 are safe and they're healthy and they're able to reach their full potential. In our work, we really seek to be a source of nonpartisan, independent information on issues concerning children ages birth through 4 in our state. Next slide. And so if we think about legislative priorities, we're always talking about funding related to the Child Care Assistance Program, or what we call CCAP for short. And if we look at the governor's budget that he put out last week, in his executive budget, he was able to maintain our state's investment of $87 million of reoccurring revenue going into the Child Care Assistance Program. This is really important that he held the line. Would we have liked to have seen an increase in what we could potentially have in child care assistance? Absolutely. But to hold the line right now, when you could be cut, feels like that is a small victory that we need to celebrate. And so this child care assistance money and another program that's under now child care assistance, the B2 program, it really expands access to quality early care and education and child care for in-need families with young children. And so approved parents or guardians must be working, looking for work, or in school, and be below the established income threshold. So if you think about our ALICE population plus our level of poverty that Michael shared earlier, you know that 51% of Louisianians are in poverty or part of our ALICE families, which means that if I look to my neighbors on the left and the right of me, somebody's struggling. And many of them are struggling to actually afford access to quality early care and education. What we know from the ALICE research is that it is really the single highest expense for families is childcare. And so while we currently serve thousands of children through CCAP, we serve approximately about 22,000 children. We have 6,000 children currently on the wait list for CCAP. And we are only serving 1 out of 5 in need birth to 3-year-olds across the state. So if we have a total number of 159,000 children that are at risk birth to 4, and of those 159,000, about 22,000 of them have access to quality early care and education. So we know that this critical investment in the governor's executive budget of maintaining the $87 million is important and imperative, especially as in the month of February, we are celebrating Early Ed Month. And so what we also know is that we fundamentally need an appropriation of an additional $115 million annually to expand access to high quality early care and education for more in need children by 2032. And that's previously recommended by the bipartisan Louisiana Early Childhood Care and Education Commission. Next slide. And so the other legislative priority is around the Early Education Fund. And this Early Education Fund really incentivizes local investments in childcare to increase access for children under the age of 4 by providing locals a dollar-for-dollar match on their investments. Even with these, there are several revenue sources going into this Early Care and Education Fund. And I would be remiss if I didn't say that Charmaine Cassiope from United Way of Southeast Louisiana and many partners on this webinar today helped really lead the charge of how do we create this Early Care and Education Fund, and how do we make sure there are investments in that fund. And so many of y'all might remember back in the 2021 legislative session when we were able to garner up 25% of sports betting revenue up to $20 million to go into that fund. Currently, sports betting is making us about $10 million of revenue in the fund that offers a dollar-for-dollar match. And so if I look at the fund today, and the fund currently is about $53 million. And of that $53 million, $25 million has been authorized to be spent in the current fiscal year that we're in. That gives you a lot to celebrate, because we know that the city of New Orleans passed a millage in April of 2022 to really support increased access for birth to 3-year-olds for $21 million for a year for 20 years. So already coming out of that fund, if there's enough money in that early childhood education fund, is New Orleans investment. It's Jefferson Parish government's investment of local dollars to be able to access the 1-to-1 match. And so what we're asking during this legislative session is really if there's a way to appropriate at least $31 million in one-time funds to the Louisiana Early Childhood Education Fund. Again, that matches those local investments, like in Jefferson Parish, like in Orleans Parish, like in Caddo and other parishes across the state, to ensure that the success of the program for another year, and it can serve the thousands of children and communities across the state. We also want to ensure that the future legislatures keep the dollar-for-dollar promise to local governments. And so we may be asking to modify the Early Education Fund statute to require matching state appropriations made every year. At the end of the day, this is good government. It's locals pulling their weight, it's state government pulling their weight, and then also the federal investment that we have. If we were to get to the total dollar amount that we need to serve the majority of our at-risk children, that would actually be about $1 billion a year. And we know at the end of the day that our greatest investment are our young children, and that for every dollar that we spend in creating access to quality early care and education, there's over 13% return on investment. And if any of y'all have heard me before, you've heard me say this. There is no bank that I can go to or an investment that I can invest in and get a 13% return on investment on my dollar. Aren't our children worth it? And so I just wanted to share the legislative session coming up and what we're focusing on. We are a part, as many people on the call today are, a part of Ready Louisiana Coalition, which is now 160 organizations strong. And that coalition is strictly focused on increasing investment in early care and education in our state. And if you think about the investments we've seen over the last several years, it's because we came together in coalition to work for the betterment of our young children. Thank you.
Thank you so much, Libbie, for sharing this helpful information. Your expertise continues to lead us and guide us. It's really important, as Libbie has indicated, that we pay attention to the CCAP funds, Child Care Assistance Program, and also to acknowledge that the governor did keep this budget in place for now. Certainly, there could have been some cuts, but that's a good thing, but certainly not out of the woods. When we think about the challenges that we face, particularly with education for the 0 to 3 population, we're well behind where we need to be. Only about 20% of those who need to be served are being served. And so there's need to do more work. One major legislative priority is to request a 31 million one-time funds to go into the Early Childhood Education Fund, which will make local municipalities, put them in a much better place in terms of being available to match locally raised dollars for early care and education. And of course, we can't forget part of our policy advocacy is recognizing that there's a significant return on investment when we invest in early care and education, some 13% return on investment. Can't do better than that in most cases. And so this has to be part of our selling points and part of our policy advocacy. Thanks again, Dr. Sonnier. It is now my honor to introduce to you Stacey Roussel. We've heard from Stacey a couple of years and really happy to have her back with us today. Stacey serves as Deputy Director of the Louisiana Budget Project, soon to be Invest in Louisiana. She brings nearly 20 years of experience in the public, academic, and nonprofit sectors, working on issues related to economic and community development, with experience in fundraising, strategic planning, program evaluation, and policy analysis. Stacey is a fierce advocate who has worked tirelessly to advance policies impacting our working Alex families. Please join me in welcoming Stacey to today's program.
Thank you, Ron. It's wonderful to be here with you. It's such a pleasure to see so many of our good friends on this webinar today. My name is Stacey Roussel, as you say, and I'm going to be talking about one of the policy priorities of Louisiana Budget Project, soon to be invested in paid medical leave. In Louisiana, about 74% of our workers are not able to step away from their jobs, have their job protected to care for their own long-term health needs, to care for a loved one with a health issue, or to bond with a new child. Of course, many of us are familiar with FMLA, which is an unpaid 3 months of leave that's available to many workers in the United States. But the truth is that Alice cannot afford to step away from her work or his work without income. And so that's where paid family medical leave steps in to fill that gap, to make that unpaid benefit meaningful enough, accessible enough, so that people can care for themselves, care for those babies before they are ready for early care and education in those early weeks. The great thing is that this policy pays huge dividends. We now have 14 states, including the District of Columbia, that have established statewide paid family and medical leave programs. And what we see coming out of those states, the evidence is showing that we are seeing and improved outcomes for babies and great outcomes for businesses as well. So we're going to break down a little bit, how do we get there? Some really wonderful news from last year. We took a step in the right direction in Louisiana, and we decided as a state to cover our state employees with 6 weeks of 100% pay for birth, adoption, and foster care of a new child in the home. This was a huge victory for Louisiana. It makes us the 34th state in the United States to grant this to our state employees. That covers both our classified workforce and our unclassified workforce. But you have probably seen in the news that our unclassified workforce benefit is in some jeopardy. That particular portion of our workforce is covered by an executive order. And so our new governor will need to affirmatively reissue that executive order that provides for leave for our unclassified employees and ensure that that benefit stays in place. Now, when it comes to need for leave outside of parental. And we know that 6 weeks is not enough, but it is a wonderful start. And it's more than we had. So where do we go from here? First, we want to see that that unclassified workforce gets to retain that benefit. And then we'd like to start joining some other southern states and other states around the country and expanding that benefit to our K-12 teachers and support staff so that they have the option to care for their own child when they are lucky enough to welcome them into their home. The long-term goal, of course, is to make sure that the benefit is available to everyone in the state through a statewide program. Work on that has started around 2015. And when that first work started, there were 4 other states in the country that had a comprehensive program. Since then, 10 more states have added a statewide program. So we would love to see Louisiana continue down that road to ensure that as workers themselves might have a diagnosis of cancer, they may have a serious heart attack, an issue that requires some recovery and some leave, or they may have a spouse or a family member that they need to care for as they recover, or they might have a new child. We want to make sure that they can afford to take the time and then return to work. So that is where we are as a state. In order to pass a statewide program that would require legislative action. In order to keep paid parental leave for our workforce, we need our governor to step up to affirm his commitment to our state's families, the workers who are part of that workforce. And then we also want to see that next step in looking at our public workforce, because we know that the evidence is there. We know that it's good for businesses. We know that it's good for families, and we know that it's good for our moms and our babies. So we're hopeful, and we'll continue to work because Alice really does deserve that time away with the income to ensure that she is able to pay the bills. So thank you so much for the opportunity to talk about some victories that we have had. And thank you to those on this webinar who are a part of the Louisiana Paid Family Medical Leave Coalition, who have worked tirelessly to get us where we are today, and who will continue to work with us to get a comprehensive program passed.
Stacey, thanks so much for again, blessing us with your wisdom and your tenacity that we know will continue to be a part of efforts to advance important legislative priorities for the budget, well, invest in Louisiana and for all of us. Stacey talked about the need in this community for paid family medical leave, recognizing that some 70% of the workers can't stop work to take care of very critical personal or family issues because they won't get paid for it. There is family medical leave, but it's unpaid. And so it still represents a significant barrier to Alice families to take care of themselves and their personal and family members' personal medical issues because they can't stop work. They won't get paid. So it's a critical issue. We also, Stacey reminded us that there are other states who have successfully implemented this program. Some 14 states and the District of Columbia, in fact. And the results have been good for both babies and businesses. So there is a track record of this program being successful. Stacey also talked about the need to sort of maintain a traction that we've already gained in terms of the state workforce getting 6 weeks of paid leave. But, there's still this issue with the unclassified workers. The unclassified workers, they were covered through an executive order by the previous governor. And so there's need for an executive order from this governor to cover this 6-week paid leave for unclassified workers. Really good information. Thanks again, Stacey, for sharing. It's now I'm very excited really to introduce our next panelist, Frankie Robertson. Ms. Robertson has worked in public administration for more than 2 decades. Her maternal and child health work spans over a decade and began as state director of Louisiana chapter of the March of Dimes. During her tenure as state director, Ms. Robertson had a very talented team who partnered with key stakeholders on successful statewide initiatives, such as the 39 Weeks initiatives, group prenatal care, baby and me tobacco free, and go to full 40. Please join me in welcoming Frankie Robertson to today's panel.
Thank you so much, Mr. McLean. So honored to be here today. I am very excited to be here representing the Moller Group. And it looks like just as I get started, I've got a little person, we're all about young people, who wants to give me a hug and say hello from Mardi Gras vacation. Hi.
Great.
Have a seat. And
Hey.
I'm really excited, I love the love, to share with everyone about our upcoming event, which is Black Maternal Health Advocacy Day. This is an event that I host for several maternal health clients, including RH Impact, formerly known as National Birth Equity Collaborative, Institute of Women and Ethnic Studies, and through partnership with Birthmark Doula Collective. So I've asked the team to drop the link to register. So drop the link to register in the chat to join us on April 17th. We are really excited about support. Stop. We are asking for individuals to work with us to support our policy measures, and I'll be happy to share those in just a second. Okay, and you can have it. One of the things that we are working with, and I wear many hats, really excited to be a part of LPIC's team through the work with the GoFar organization, or the GoFar coalition. I serve as an implementation partner through the Moller Group. So some of the policies that I share today will also be shared in coalition with GoFar. So first, I'll start off by saying one of the things that we are pushing for the legislative session will be increased Medicaid reimbursement rates to parity with Medicare. That's something that we're working on in partnership with our friends at LPHI and many others. We all recognize and understand how the inequities exist between the reimbursement rates for coverage for Medicaid. You did. It's beautiful. Versus private insurance. Thank you.
Oh, yeah.
Thank you. We are working to increase. Okay. Increasing the Medicaid reimbursement rates. This is a delight to engage in the meetings, trust me. The next thing we're working on is working to, I would say, create uniformity in the doula Medicaid reimbursement process, right, and the coverage rates. What we see is that although we are really grateful and excited that last year the Department of Health created an in lieu of, created an in lieu of policy that provided coverage for Medicaid, but there are some inequities that still exist. So we're going to be working, have a seat, and we'll get to that in a second. We're going to be working towards creating some uniformity and equity in the reimbursement rates there. And the last thing that I'll share is that we continue on our quest to create proper support for women and birthing people in the postpartum period. Looking at it is just one second, just a second. What we're looking at is making sure that birthing people and women have adequate lactation support services in the postpartum period, as well as proper mental health support. So we're working on providing additional support in the postpartum period related to perinatal mental health, in addition to making sure that women and birthing people can access breast pumps equitably, and also access things such as hospital grade breast pumps without the additional struggles that they see. In addition to that, of course, we're supporting much of the work that was shared here today, including paid family leave, and also continuation of the work with budget project, LPIC, Partnership for Children, Families, and others to increase, to close the coverage gaps and the extended postpartum coverage for, yes, 1 second, extended postpartum coverage. No, just a second. So those are a few things that we're working on, and I'm happy to also entertain any questions. Thank you.
Wow. Thanks so much, Frankie, for sharing this information. It's really important for us to understand how poor, Black, and other women of color are disproportionately impacted in the whole perinatal period, particularly around maternal mortality. Huge numbers in terms of how many Black women are dying after birth as compared to their numbers in the general population. Ms. Robertson also talked about this huge Black Maternal Health Advocacy Day, where more and more people will get together to advocate for a better response from state and other governments to Black women in particular as they go through the whole birth process. Ms. Robertson also talked about other inadequacies and disproportionate negative outcomes that exist for Black and poor women, particularly around the need to increase Medicaid reimbursement. And also she talked about the need to increase doula Medicaid reimbursements. There's a need for a lot more equity there in terms of support for poor women during the birth process. Ms. Robinson talked about how there's a need for more support for postpartum services, particularly around lactation services, perinatal mental health, which is really important, and just the need to recognize that many poor women of color are not given a fair shake as it relates to their interface with healthcare systems in the state. And Ms. Robinson, others will continue to advocate for equity in that area. So thanks again, Ms. Robertson. Now my pleasure, really my great pleasure to introduce Morgan Shannon. Ms. Shannon is a crusader for communities of color. Morgan's passion has allowed her to build connections among various stakeholders, including youth advocates, organizers, and philanthropy. Morgan serves as program manager at the W.K. Kellogg Foundation, where she worked with the Mississippi, New Orleans, and Boys and Men of Color portfolios. She also served as program associate at the National Association for the Advancement of Colored People, the NAACP, where she supported the health and climate justice programs. Please join me in welcoming Morgan Shannon to today's program. You might be on mute, Morgan. I think you're on mute. Morgan? There you go.
Okay, cool. All righty. Thank you so much. So thank you so much, United Way, for inviting the Power Coalition for Equity and Justice to this discussion. And I'm excited to see many of the colleagues that we fight using all the tools in democracy to be able to advance equity and justice. So thank you so much. Really quickly, I'll go through our 2024 policy priorities. The Power Coalition is a statewide civic engagement table that works to activate power in Black and other oppressed communities of color around Louisiana. And we do this through a myriad of ways. We do it through your traditional electoral organizing. And so that's your registering, get out the vote, those kinds of things. We do it through issues organizing around paid leave, around Black maternal child health, around criminal justice, housing, and those kinds of things. We also do it at the Capitol, at the federal, state, and local level through advocacy. And so we believe in using all of the tools of democracy to be able to advance equity and justice. And as you see in my subheading, intersectionality is mandatory in policy advocacy. And that's what the Alice report is all about. Oftentimes when people are experiencing economic insecurities, they could be experiencing housing insecurities, they could be criminal justice involved, dealing with the healthcare system, all at the same time. And so that is why it's important for our policies, for the work to be intersectional, because people aren't experiencing issues in a vacuum. They're typically experiencing an overlay of issues. Just some key dates, just to make sure that we all know that the session will start on March 11th, though we've had the redistricting session, the special redistricting session, which led to a second Black majority minority seat, which is really important in terms of our power building and our voice. And that gives us more power, and that gives us more power at the federal level and more representation of what Louisiana is. Louisiana is the third Blackest state in the union, and that we should have more than 2 seats, but that's what we've been fighting for a couple of years. And so that was a people's win, and we really appreciate everybody who stood with us in solidarity to make sure that we took that to the finish line. Also, there was another win that happened just right after that, that's going to reconfigure the way that the state House and Senate looks. So that could also be more representative of what the community and what people look like. And again, that is more voice, more power for folks to be able to change the trajectory of their lived experience. And so I just wanted to lift up those 2 wins of some of the work that Power Coalition and our partners do. So here are some key dates that folks will have. We had the redistricting session. We'll have this special session on crime that we saw Governor Landry's 24-point plan that he wants to put out to criminalize folks even more than we already are. And so that is something that we're going to have to stand in solidarity with our criminal justice advocates around, to talk about those intersections and how that affects folks that have already been overburdened. We know that more criminalization is not the answer. And we also know that early investments in things like paid leave, investments in things like early care, investments in things like that will help that we don't have to make criminal justice investments later. I did want to let you all know that the Power Coalition is doing a legislative deep dive. And so please join us. You are able to sign up. I'll drop it in the chat once I finish chatting with you all. But please join us for this legislative deep dive. This will be helpful if you want to figure out around testimony prep, if you want to have a review of the legislator and much more. It's going to be in New Orleans. It's next Wednesday. You please share this with you or anyone that's in your circle. You can have a not that much experience at the legislator or all of the experience at the legislator. We really just want to learn from each other. Of course, we'll always have food, materials for folks to be able to take, and travel stipends will be available. And so that'll be next Wednesday. Just a little bit of history on what Power Coalition. We are in partnership, deep partnership with all of the speakers that spoke today in coalition and in deep partnerships. Either the speakers are in the organizations, are in our coalition, like the Budget Project, or formerly known as the Budget Project, like Prince, or the Policy Institute, but then also in deep partnership with Amandala and others as well. We are really working on voting rights to make sure that we are expanding the vote. Those are also the ways for Pathways to Power. We've been doing this for a while. Expanded early voting for presidential elections. So this presidential election in November, early voting will be expanded. We extended the 3-minute rule to 6 minutes so that you have more time in the booth. We know that there is lots of things that are on the ballots. The ballots are usually long, like War and Peace. And so we need a little bit more than 3 minutes in there. And so we were helpful with that. Require that the polling changes the polling locations to be posted on the Secretary of State's website. Last time that we voted, it might not be the last time he voted, but like in December for the runoff, there was like over 200 polling location changes. And so those things need to be posted so that folks are able to see them. Codifying the redistricting roadshows. The redistricting roadshows was a great way to be able to get community input. We want to make sure that that is the law moving forward. And so that was a bill that we passed. And then also expanding voting rights for folks with disabilities, accessibility. And so where other states were going a little further back or taking away voting rights, Louisiana actually was helpful in expanding or at least keeping a lot of the voting rights that we have. And so we're going to continue to be able to do that. Things that we have that are useful. We have a bill tracker where we track all of the bills, where they are. Many folks have bill trackers. We have one too. Again, ours is going to be involved with a lot of the different issues that you all heard here. We tend to track them so that we know where they are and that you can see all of them. And then we also have tabs based off of issue areas as well. And this will be available on our website, but we also have a Google Sheet as well. In 2024, we will be addressing the excessive election and voter fatigue, closed primaries. Now, this was something that was brought up in the redistricting session as well, that I'll get to. Expand early voting sites, making sure that there are more early voting sites for areas, especially areas with bigger populations. We just did this in Shreveport, and we saw the benefit of that. Almost that we got our first progressive sheriff in Shreveport. Now we know what happened with that sheriff's race, and we're going to be at it again on March 23rd in Shreveport. But that also helped with voter turnout in Shreveport. And then voting rights during pretrial. For some reason, even though you have not been convicted by a jury, if you were in pretrial, your voting rights are taken away from you. And so that we want to eliminate that. And that is something that we are looking to be able to sponsor. Some other things that we're looking at is the mother's maiden name for your voter registration. If you do not have your mother's maiden name on your voter registration form, they will not accept it. And we know that that is a form of voter suppression. Also, poll site changes. We want to take that a little further. We want to have public disclosure to clarify where the polling sites have been changed and why. Again, I mentioned this last election, December, it was over 200 polling locations that were changed. We just need a little bit more due diligence to the public on why that was. And of course, we'll be working with all of our partners, but I just named some here. The Budget Project, Invest in Louisiana on paid leave for educators, and doing some clean air and wind and other policies. That might have been my last. Yes, that was my last slide. So I'll turn it back to you.
Thank you, Morgan, for sharing the legislative priorities of the Power Coalition for Equity and Justice. Certainly, you have highlighted the fact that intersectionality has to be a part of any policy advocacy, because people don't experience one challenge at a time. Oftentimes it's a cluster. And so there's a need to look at the multiple issues impacting families, particularly our ALICE families. The Power Coalition is also concerned about particularly this new special session that the governor has called on criminal justice, the possibility that more and more people will be criminalized, which is not in the best interest of people in the state, particularly ALICE families, but it's not in the best interest of the state either. So we have to talk about why this is potentially going to happen and fight really hard to stop it from happening. Morgan talked about the 24 different issues that he has discussed. I've read them, and it's quite sobering. Some of the things related to, carrying concealed weapons without permits, expanding, lowering the age that people can be sentenced as adults, children can be sentenced as adults. And there's more and more challenges that we face with this new special session, and it really demands for us to pull together and advocate. Morgan also talked about how we should use all the tools of democracy to fight for equity and justice, and we should recognize that Black and oppressed communities of color are disproportionately impacted by a number of legislative policies, and we need to continue to pay attention to this. The Power Coalition also has a number of resources to help build our capacity to be policy advocates. Coming up next week, actually next Wednesday, there's this legislative deep dive that could really help us understand what's going on, but more importantly, understand how to intervene and how to effectively advocate. The Power Coalition also has a bill tracker that provides a lot of information about the bills and their potential impact for Alice families and others. It is now my pleasure to once again turn the program over to our great host, Mr. Todd Baptiste, who will open up today's program with questions that we've already received in the chat.
Yeah, thank you,
Todd.
Ron. Thanks a lot. We have a few questions that were entered into the chat. The first one is directed, I guess, to Jan and Stacey. And the question is, can Landry's decision not to accept federal money to feed hungry kids this summer be reversed? And it's their understanding that the deadline for that decision is today.
Yeah, and so just to be clear, Jan had to leave early, but Stacey is here, and Jan did put some information in the chat relative to that issue.
Okay.
Yes, thank you for that. And I'm going to keep my video off to conserve some internet bandwidth. The unfortunate news is that the federal deadline is today, and we did see governors in conservative states, including Nebraska, change course and say initially that they were going to decline the funding and then understand the impact that it was having on poor children around the state and decide instead to accept it. So it's not unprecedented. It's still possible. Certainly Representative Carter and Council Chair Moreno in New Orleans have requested very specifically to the governor's office to reconsider. But if he misses today's deadline, our understanding is that the next point of advocacy would be for acceptance in 2025.
They also asked, Stacey, can we use a link to pressure the governor to continue paid family leave?
That's a great question. There is not a link that's been created right now. My understanding of the timeline for this is that the governor will have until the summer to reissue the executive order that includes the 6 weeks of paid parental leave. And right now we're working closely to try to educate his staff and within his office to understand that really, when it comes to this type of benefit, state agencies are already budgeting 12 months of salary for their employees. There's not an additional cost unless you have a position that requires a person to be present. So that could be like maybe a prison guard, or also in the case of teachers, they're not covered in the executive order. That is separate. But right now, our efforts are really in sharing information from other states that have done this, as well as work that the State Civil Service Commission did in their due diligence, talking to agencies, understanding that this was a burden that they really felt that they could absorb and felt that they were prepared to take on and was not going to come at a big cost. So if a link becomes available, and that public pressure is helpful, we will absolutely share that out.
That would be great. Thank you very much, Stacey.
Thank you,
Our next
Todd.
question is for Frankie, and they are asking, what conversations have you had with the new administration related to maternal health? If none, How do we anticipate Governor Landry will approach this urgent issue moving forward? So it's an
It was a
anticipation question.
Yeah, what communication have we had with the new administration, and how do we anticipate the governor will move forward? Is
With
that
this issue,
what I heard?
yes.
Yeah.
Yes.
Oh, great question. So through partnership with several organizations that we're working with, there's been several partners in our circle who a handful that have had conversations with the administration. We have had conversations with a key official as a part of the transition team with the new administration that has been helpful in guiding us. From what I understand, the plans of this administration in terms of priorities, maternal and infant health is still one of the top priorities. I think it's very obvious in terms of some of the priorities that may differ from the Democrat administration versus the Republican administration. There may be some areas that we cover in terms of like reproductive justice that we won't align on, but there are other areas that we will align on. So far in the conversations that we have had, we understand first and foremost that it is a top priority, which is what we want to hear. Secondly, we are actually awaiting a meeting to be able to meet with the health department directly with the executive team. And we anticipate that those priorities that don't fall along party lines will be able to have some very productive conversations. And as with all things, we'll continue to have conversations about the totality of women's health in our state and continue to work to educate. So I think that was a great question. Thank you.
Thank you, Frankie. And we have one other question. It asks, what strategies, and this is for each of the panelists, what strategies or initiatives can we prioritize to ensure equitable access to early care and education, paid family leave, mental health resources, maternal health support, community strengthening programs within the Louisiana state budget? And how are those efforts being integrated across diverse needs of Alice families? So we would pose that question to each of our panelists.
Okay, I'll just go ahead and hop in there since I'm the last one to answer. So a few things. I think one of the policy priorities that I mentioned was looking at increasing Medicaid to Medicare rates. There's a huge inequity issue there where we have expanded Medicaid in our state, but because of the low and inequitable reimbursement rates for a human being covered through Medicaid versus a human being covered through private insurance, there are medical establishments that are not serving people who deserve the same amount of access, the same amount of quality treatment because of low reimbursement rates that are relatively inhumane. So we need financial investments there. There are financial investments that have to be budgeted, as I mentioned, with the doula piece to make sure that doulas are compensated equitably for the life-saving care that we all recognize is provided by doulas to birthing people and women and people in the postpartum period. We also know that we have to have businesses that come on board to pay people adequately, living wages and beyond. Why do I mention this? And I'm talking about maternal and infant health, because at the heart of this and at the root of these inequities is a really important issue to address by way of economic justice that fuels the inequities related to the social determinants of health, that has a ripple down effect and across the board that impacts the life course of birthing people, because poor birth outcomes don't start when you become pregnant or when you're in your postpartum recovery. So I will turn it over to the other panelists to share much more, but those are three key areas that are very important.
Now I'll jump in here related to early care and education. Over the past few years, we really worked very hard on policy and rulemaking, which means that we would get away from the market rate survey. So the market rate is what the average cost of tuition in a child care center is in a region, and really are moving more towards the actual cost of care, which is what it actually costs to cover the care for the child care center owner provider. The childcare assistance rates are getting closer to the cost of care to really cover, you know, low teacher-child ratios, all those elements of quality that are so important. Why it's important to move towards the cost of care is this. If you look at the market rate survey, you're not really helping the family afford what it costs to have their child and have access to quality early care and education. With our child care assistance rates have gone up quite a bit over the last 3 years. And so what it's allowing our businesses to do is to create more access for childcare because they have a stable funding stream for those kids that are receiving childcare assistance. And, you know, to Frankie's point earlier, if we talk about a livable wage, if we look at our early care and education teachers, many of whom are ALICE, it's making sure that their rate of pay is helping them to have ends actually meet to take care of their families. And so if you think about the work of the prosperity centers, if you think about the work through during COVID that United Way Southeast Louisiana did with childcare providers to help them understand all like the PPP loans and those pieces to have a viable business that can actually serve children, that we want to make sure that the cost of care is being covered so that we can pay teachers a competitive wage. Like we're not calling it livable anymore because what's that? But what's a competitive wage with benefits? And what we know is that when these teachers are compensated competitively, they're creating better access to care and quality care. And so they're not worrying about keeping a light bill on because they know their light bill is paid for and that the stress that they're experiencing is less and they are passing on better care to children. And so if you think about from an equity lens, you're meeting the needs of the teachers to meet the needs of the families, to meet the needs of the children. And at the end of the day, that's what we all need to do because it really is a system. And I would say if we're really talking about how we care about children and access to quality childcare, then, you know, like I think about the work that the Budget Project and others are doing related to paid family leave.
Mhm.
You know, that you don't have to go back to work at 6 and 8 weeks post-birth to make sure that you're really able to care for your children in the way in which that one you want to, that you need to, but also as best practice that we know have better outcomes.
Thank you, Libbie.
Thank you, Libbie, for mentioning that. And thank you for the work that, to all of the panelists and also our host for the work that you all are doing advancing these policies. I'm going to take just a minute to echo some of the words that Jan shared. He did have to leave for another meeting, in that we're all getting ready, not just for this year's general session, but for next year's fiscal session, because what we are going to be hearing and what you've already started to hear from the governor's office through executive order a couple of weeks ago is belt tightening. And what we need is investment. And so we're looking at in 2025 a fiscal cliff of $500 million or more out of the state general fund. And that's going to cut and put pressure on things like early care and education, on Medicaid reimbursement rates, on teacher pay. All of the areas that we know are important to support ALICE families to getting to the next stage. So that's one of the areas that we're going to really be focused on. And of course, you also hear from time to time ideas of getting rid of the state income tax. This is a favorite that comes up over and over, but it never has a pay for. And that's, $5 billion out of the state general fund. So if you are interested in staying involved and engaged in this, I'll put a small pitch for our Daily Dime. This is a publication that comes out every day where we get to highlight the issues that impact ALICE families from around the state, the local and national news. So that's Daily Dime, and that's you can go to labudget.org to sign up for that. So thank you again for the opportunity to talk about and share this information.
Thank you, Stacey. I think we've gotten responses from all of our panelists. We have no other questions in the chat. I will now introduce Charmaine Cacciopi. Charmaine Cacciopi has focused on public policy, governmental affairs, and community impact. Her career at United Way of Southeast Louisiana has included the successful advocating for the first ever EITC state match, passage of the child care tax credit, implementing statewide high-quality early child care rating system, a fierce champion in the fight against domestic violence, sexual assault, and human trafficking. She has fought tirelessly to secure state funding for Louisiana 211 Information Referral and Crisis Management System, early care and education, safe schools, paid family leave, and breast cancer survivor services. It gives me great pleasure to turn the panel over, or turn the Zoom over, to Charmaine Cacciopi.
Thank you so much, Todd. I'd like to begin by especially saying to our esteemed panelists, thank you, thank you, thank you. I think you can see firsthand why each of these individuals are legislative champions for the United Way of Southeast Louisiana. I am honored and I'm privileged to be working alongside the caliber of these individuals as we work tirelessly to fight for Alice families during our legislative champion events, but more importantly, during the legislative session. I can tell you that they are remarkable and they are evidence that none of us do this work alone. As I'm sure you heard, today's educational forum is only one in a series of two. We're going to put the link in the chat box. If you haven't registered for tomorrow's educational forum, I would encourage you to tune in. We will be joined by the Secretary of the Department of Children and Family Services, the Deputy Superintendent for the Department of Education, and we'll be hearing firsthand from the Chair of the Domestic Violence Prevention Commission. All of these issues are incredibly important, and the work that we do in partnership with the Department of Education, the Department of Children and Family Services, and the advocacy that we are doing working alongside the Coalition to Prevent Domestic Violence is really, really important work. So please join us. But as I prepare to close today, I'd like to remind each and every one of you that the United Way of Southeast Louisiana's public policy team advocates year-round for policies and programs that advance our mission to eradicate poverty. As you can see by today's program, we work collaboratively across all sectors to advance bipartisan policies in health, education, financial stability, and community strengthening to create opportunities to help vulnerable households thrive across the great state of Louisiana. I do firmly believe, and I know you do too, that together we can create truly equitable communities, and we need to be engaged. I am encouraging each and every one of you who joined us today, please continue to stay focused on the policy agenda that United Way will be presenting in partnership with our Public Policy Committee and approved by our full Board of Trustees. We need you to adhere to our action alerts and to stay informed throughout the special and regular session. I would be remiss today and not acknowledging before I close these remarks that I say thank you to Pam Allison, my partner in United Way's public policy team. Nothing that took place today would be possible were it not for her extraordinary work and her conscious effort to make sure that every I is dotted and every T is crossed. Thank you to the communications and marketing team that United Way is so blessed to have. They take care of all of our IT requirements to make sure that events like today's program goes off without a hitch. But I would be remiss in not acknowledging the courage and the commitment of our Board of Trustees, our Public Policy Committee, because it's through their continued dedication to United Way that we are able to have the kind of progress we see at the local, state, and federal level. Were it not for their volunteerism and their commitment to United Way, none of this would be possible. Please join us as we celebrate our centennial this year, and let's make the advancements in policy and advocacy unprecedented in the coming legislative sessions. Thank you so much for joining us today. And again, thank you for everyone that's been with us.
That concludes our program.
Thank you.
Thank you. We'll see you all tomorrow.